Session on evidence-informed policymaking experiences from Latin America. I am Dr. Andrea Yearwood, the moderator for this session. I am a freelance researcher. I support organizations with their health policy and programming using the evidence-informed policy approach. Along with me today as panelists, we have Daniel Patiño-Lugo, Lucy Kuhn, and Laura Boera. These three very esteemed researchers will showcase the work being done by their respective organizations. Daniel works at the Unit of Evidence and Deliberation for Decision-Making at the University of Antioquia in Colombia. Lucy works at the Ministry of Health in Chile, and Laura is the Executive Director at the Veredas Institute in Brazil. Welcome to all panelists and all participants. Our session today will explore the experiences with evidence-informed policy from the perspective of these three organizations. These three organizations are quite different. One is a civil society group, one is based in academia, and another is based in government in the Ministry of Health. Now, those of us who work in the sustainable development space will understand the need for collaboration among these three stakeholder groups: civil society, government, and academia. So I think it would be very interesting to understand today how these different organizations approach evidence-informed policy and its various challenges. Some of you may be wondering why Chile, Colombia, and Brazil have come together to present at the African Evidence Week. So to provide a bit of background, both three organizations are part of the PAIRS. PAIRS is the Partnership for Evidence and Equity in Responsive Social Systems. The aim of this partnership is to build a conducive environment for advancing evidence-informed policy. There are 6 African countries that are also part of this partnership. So at the end, during and at the end of our session today, we would very much like to explore how we can deepen collaboration, South-South collaboration across the Atlantic. Now, before we begin, just a bit of housekeeping notes. Please, we would like to ask all participants to keep your microphones on mute. If you would like to keep your cameras off in consideration of bandwidth issues, that would be fine as well. At the end of the 3 presentations, we would have a Q&A and discussion session. However, feel free anytime during the presentations to send in your questions via the chat box. If you would like to direct it to a particular speaker, please indicate so in the chat box. The session today will be recorded and made available as part of the proceedings for the overall conference. So we have some very exciting speakers today with very interesting backgrounds and a wealth of experience. So I would like us to really move forward with our first speaker. Our first speaker is Daniel Patiño-Lugo, who will share experiences from Colombia. Daniel is a professor at the Faculty of Medicine at the University of Antioquia in Colombia. He's the co-founder of the Unit of Evidence and Deliberation for Decision-Making, which is a university-based team. Prior to this role, Daniel was director of the Medical Research Institute at the Faculty of Medicine. He is a biomedical engineer and holds an MSc in Health Technology Assessment and a PhD in Health Policy. Daniel, I hand over to you.
Thank you, Andrea. And hello to everyone. So let me share my screen and please let me know when you see it.
Yes, we can see it.
Mm-hmm.
Okay. Can you see it?
Yes.
Yep.
Okay. So good morning and good afternoon to everyone. Thank you to the organizers of the African Evidence Week for having us here, for having colleagues from Latin America discuss about our efforts to support this movement of evidence-informed policymaking. I am here because I am part of a partnership with Laura and Lucy and other colleagues from Africa, from 6 different countries in Africa. And it's these partnerships that began since 2018, but it materialized in 2019. And this partnership it gave us the support to create this unit that I'm going to show you in a couple of minutes, a unit that we have at the Faculty of Medicine at the University of Antioquia, which is a university based in Medellin mainly, which is not the capital of Colombia. It's like the second biggest city in Colombia. It has around 10 million people. And so we created this unit thanks to the efforts and the collaborative efforts of these partnerships. The unit, it's called the Unit for Evidence and Deliberations to Support Decision Making. So I think it's important to tell you a little bit of the history of how we created this unit and how we come to be what we have now. This history, I think, is important to tell the story behind it, because it will give you a clear picture of what are our skills, why we work in the topics that we work, and what are the main challenges that we have. So we are in the Faculty of Medicine, and in 2005 we created a master program in clinical epidemiology, and I think that was one of the first important steps within the university to build capacity around some of the methods that we still use to support evidence-informed decision-making efforts. We start giving courses on health technology assessment, systematic reviews, and especially about the value of evidence synthesis to support decision-making. At the beginning, it was more at the professional level, right? Decision-making for health professionals, to support decision-making efforts for health professionals. But the methods of research of evidence synthesis and systematic reviews we started developing those methods in 2005, and to create capacity in students who were going to be professors, and now they work at the Unit for Evidence and Deliberation and help us doing the products that we do. So I think the creation of the master program in clinical epidemiology was one of the key steps towards the creation of the Unit for Evidence and Deliberation. In 2010, something happened very important at the level of the at the national level. The Ministry of Health called for more than 50 evidence-based clinical practice guidelines for priority health problems in Colombia. So these were 50 clinical practice guidelines. This was a very unique approach that we took in Colombia, because usually clinical practice guidelines are developed at the organizational level within hospitals or within insurance companies that we have here in Colombia, health insurance companies. But this approach was at the national level. The Ministry of Health wanted to have clinical practice guidelines with recommendations about effectiveness, safety, and cost effectiveness of the main health problems in Colombia. And we, in the university and some of our colleagues, we created an alliance with other universities in the capital, in Bogota, to develop some of these clinical practice guidelines, and we have developed more than 15 clinical practice guidelines at the national level in Colombia. In 2011, Colombia created the National Health Technology Assessment Agency, which is it's an arm's length agency. It's linked to the government. The intention of the agency is to provide recommendations about health technologies to the Ministry of Health. And because of the experience that we had with the clinical practice guidelines, some of our researchers were able to run this agency and to work closely with the national level in Bogota and with the Ministry of Health. And those connections, those linkage, that linkage that we have with the national level, we build on that, and we still work with the national level in the health sector because of that connection. Later in between 2010 and 2018, 3 of our researchers at the unit were able to get proper training to complete their PhD in health policy and health research methods at McMaster University. We were able to work and to understand the theory behind knowledge translation and to work on developing products such as evidence brief, stakeholder dialogues, and other evidence-informed decision-making processes. And in 2019, we joined this partnership, the Partnership for Evidence and Equity and Responsive Social Systems, which is called PEERS, with 6 African countries, where South Africa and our colleagues from South Africa are one of the groups that is working here, and that is why Laura and Lucy and me are here presenting with you and trying to show you our experience. And that project was what helped us to create the Unit for Evidence and Deliberation at the University of Antioquia. So this is what we are, and this is what the definition that we came out for the unit. It's a unit to support decision-making of citizens, patients, communities, professionals, managers, organizations, and policymakers using the best available evidence and people's values and preferences. So since we work in the health sector mainly, we did work to support policymakers, but we also do a lot of work for professionals and for institutions, for clinical practice guidelines, for instance. Something that we haven't explored much, but we want to explore, and we think is important, is to do to support patients, communities with the best available evidence, and that's something that I think that's one of the things that we look forward to develop in the next coming years. And the other important part of this definition is to work with people's values and preference, and that's something that we don't have much experience in, but we are trying to get at those values and preference. We know how to do it when we develop clinical practice guidelines, because we follow something that is called the GRADE approach, which has a clear methodology to incorporate values and preferences. But for other policy issues, or for other sectors different than the health sector, we don't have much experience in incorporating people's values and preference. In the next future, we are going to do some citizens panels about some issues that I tell you in the next slide, but it's something that we want to work in the near future. These are some of the products that we do. We do evidence briefs and stakeholder dialogues. We are working right now with the Ministry of Health in an evidence brief about effectiveness, safety, and regulations of medical cannabis. We are working on another evidence brief in antibiotic resistance. We are finishing the first draft of that. And we're working on an evidence brief of what are the health systems arrangements that we need to do in Colombia in order to better support the implementation of guidelines recommendations. All the work that we did in 2010 with the clinical practice guidelines. Many of those guidelines have not been implemented by the Colombian, even though they were promoted by the Ministry of Health, they haven't been implemented. As I told you, we are not based in the capital. We are based in a province in Colombia, which is called Antioquia, and we are based in the capital of Antioquia, which is called Medellin. And we work with local governments in something different than health. We work in developing an evidence brief to support children's participation in policy decisions. And that was a very interesting work that we did last year. We work in rapid synthesis. We developed rapid synthesis in 10 days, 30 days, or 90 days. And we have developed more than 15 in the last year for the Ministry of Health, for the Ministry of Education. A lot of them, most of them, related to the pandemic, to COVID-19. We work with COVID-End, which is an international network that is supporting the production of rapid synthesis in terms of COVID. And we also produce rapid synthesis for local governments. If you go to this web page, you can see all of our rapid synthesis. We have the key messages translated in English, but the whole document, it's in Spanish. We also have we don't have much experience, because I know a lot of people, our colleagues from Africa, have developed evidence gap maps or evidence maps and have a lot of experience with that. We are starting to work with that. We developed one exercise about homeless policy for a local government in Antioquia that I have the link there if you wanna look at it. And the other, as I told you before, we want to do more about patient and community decision aids. And we developed a tool for parents with evidence-based information related to a school reopening. That's something that maybe I'll tell you later, but it's a work that we did for the Ministry of Education. And we try to develop an evidence-based tool to support parents about what they needed to know to send their kids back to school. We do health technology assessment reports. And since we are based in a faculty of medicine within academia, we are constantly engaged in teaching and continuing education programs and in research activities. This is some of the groups and the networks that we work with. The Peers project that we have mentioned at the beginning, the McMaster Health Forum, the Global Evidence Synthesis, EBIBNet, Health Systems Global, the Alliance for Health Policy Research and Systems, Cochrane, and AGREE. We are one of our colleagues and one of our researchers is in charge of the coordination of the AGREE project, which is an appraisal of, it's an organization that develops tools to appraise clinical practice guidelines. So a lot of these are very health related. So we are now in the process of trying to move to other sectors and trying to move the methods and what we do in the health sector to other sectors. With the Global Evidence Synthesis Initiative, for instance, they provide a lot of supports and webinars on how to do that. Some of the challenges that we have to support evidence-informed decision-making in Colombia, or not in, some of the challenges that we have at the unit. One is the geographical location. Colombia is a unitary system, it's a presidential system. And since it's a unitary system, everything happens in the capital, like the big national decisions happen in Bogota. So we have to make an extra effort to be able to create alliances with different groups within the capital of the city to be able to influence national policies. As I told you, in the history of our unit, we've been building a long-standing relationship in the health sector and mainly in the development of health technology assessment and clinical practice guidelines. So that's where we can influence more at the national level. But when we try to move to other sectors, the educational sectors, the other sectors different than health, we haven't built all that collaboration with teams in the at the national level. So that has been, it has been difficult to develop, but that's we think it's something that we have to continue working on, and maybe in the future we'll have more linkages in other sectors different than health at the national level. The efforts that we have accomplished are more at the local government, at the local level in Colombia. We don't have an identified coalition like you have maybe, or what I see in different, in Africa, for instance, in the continent, you have identified different teams around Africa and in different countries in Africa that work with evidence-informed decision-making. We don't have it in Latin America. We are trying to create that with Laura and Lucy and the teams in Latin America, but it's not as connected, I guess. It's not as identified as I see you have it in Africa, and we don't have it in Colombia. I think Brazil is doing great work, and Laura will tell us more about it. But that's something that we haven't identified in Colombia, like a clear coalition of groups that work on evidence-informed decision-making. One of our challenges, as I told you, is working on sectors different than the health sector. Our experience, it's been on the health sector, where I think, at least in Colombia, because of the process of the clinical practice guidelines, the value of evidence synthesis and evidence-informed decision-making, I feel, is more recognized in the health sector than in other sectors. When we try to work with other sectors, we have to spend a lot of time trying to explain why it's synthesized evidence or systematic review. What is the value of systematic review, and what is the place of the reviews in the policy cycle? So, and I think that's something that in the health sector is already we already gained that space. So moving to other sectors or policy issues such as children's policy or homeless policy brings new challenges for us, and that's something that the collaboration that we are trying to create with teams in Africa, with teams in Latin America, that's where we can learn a lot. The language and research production, translating evidence from English to Spanish takes time and human resources. And for instance, now that we have, during COVID, I guess we have the collaboration between different groups has increased, but everything is produced in English. And for us to be able to use the evidence that is produced in other countries to inform policymakers here or to inform community, because there are some evidence that can be used without much contextualization, I guess. It needs resources, it needs funding, it needs people to be able to speak both languages, English and Spanish, and be able to translate in both their directions. And that's something we struggle a lot. It might be not something that you struggle in some of the African countries where you speak English, but in Colombia, it's something that and in Latin America, I guess, English is difficult to find human resources able to know experience in knowledge translation and to be able to speak English, Spanish, and Portuguese. It's a challenge that we are trying to overcome with some ideas that we have for the near future. There is also a lack of policy relevant research production. And I say this because when we do all the synthesis and we try to look for systematic reviews or evidence synthesis about policy issues important for Colombia. We don't find a lot of production that is done in the country. We find some, I'm not saying there is none, but the difference between the production that is done elsewhere compared to what is done in Latin America or in the South sometimes is overwhelming. Some of the opportunities that I see to inform decision-making or to support these efforts in Colombia is the increased demand that we have during COVID-19. We created the unit at the end of 2019, and at the beginning of 2020, we were hit by this COVID-19 pandemic, and we just started to receive a lot of requests from policymakers, from the directors of the university. So we have developed, for instance, evidence synthesis about mental health of professors at the university, of mental health issues of students during the pandemic. All of those requests from people from our university. We have received requests from policymakers in the health sector, in the educational sector, and we haven't been able to cope with the increased demand for this type of products. I think the last year and this year has been very overwhelming in terms of production and in terms of the workload that our team has to do to produce all these documents. There is an increased global and regional collaboration. I think there is an increased interest in creating networks and groups that work to inform policymakers. And this, what we are doing today, is an example of that. The connection that we are trying to link with Laura and Lucy in Brazil and in Chile, it's an example of that. So I just have three examples here. The Peers project that I mentioned, where we are connecting with different countries in Latin America and with Africa. The Brazilian Chile Colombia Evidence Hub that it's coming in the future. And the connection with the African Evidence Week that we have right now. Those are examples of this increased interest in creating collaboration. But also I think there is an increased interest in linking different groups that work to support evidence-based decision-making. So people that works in data analytics, for instance, and I know you, in the African Evidence Week, you have some presentations around this. People in the health sector, people who work on health technology assessment, on people who work on clinical practice guidelines, all those teams that their purpose is to support and inform decision-making at different levels. I think there is an increased interest in linking all those efforts together. And these collaborations will help us, especially at the unit, to learn how to apply these processes to sectors different than health, which is one of our challenges, to move to other sectors, and to learn more on how to contextualize research results and how to create a national coalition for evidence-informed decision-making, something that I think Brazil is doing a great job there, and Colombia can learn from it. Finally, I just wanted to show you just a recent work that we did for the Ministry of Education. We developed different rapid synthesis about the adaptations of schools for the safe reopening, the safe conditions for providing school meals during COVID, mental health and occupational health for professors, and considerations to guarantee the safety and the process of reopening institutions in higher education. So we develop synthesis for elementary schools and for university schools. And we developed something that we are very proud of, but I think it hasn't been used as much, but we developed a parents' decision aid so that parents could know about the facts and what the evidence says about COVID-19, what the evidence says about sending back their kids to school, the safety concerns, the need to send kids back to school, and how they do it, how the benefits of different strategies that the schools were implemented. We have something about explore your feelings, explore where your values are, what is more important for the parents. I think the decision to send kids back to school when we did this, which was in November 2020, it is not only a decision about evidence, right? It's a decision about your own family context, whether you have the support to be with your kid at home, whether you live with people who has comorbidities, where sending your kid back to school could be more dangerous than if you live just with your kid. So these explore your feelings were questions for parents to help them think about what their values were and what their preferences were about sending their kids back to school. We had another point about trying to assess what they learned from the facts and key messages to remember. So I think these evidence-informed decision products developed for community or for patients, I think that's where we want to go in the future, and that's where we're going to put some efforts in the future. So that's all that I wanted to say. Gracias to all of you for listening to this presentation, and I look forward to your questions and discussions. So back to you, Andrea.
Thank you very much, Daniel, for sharing with us what your unit for evidence and deliberation has been involved in. I notice, interestingly, as an academic institution, that your mission has a very clear focus on supporting audiences, very clear audiences, citizens, parents, communities, professionals. That was jumped out actually as being, very interesting. I note as well the challenge of attempting to build a network in Latin America. Our colleagues in the African continent has lots of experience with respect to network building, and I trust that during the discussion period, they would be able to share with us some of their insights on how it can be strengthened in Latin America. Moving on to our next speaker, we have Lucy Kuhn. Lucy is an economist. She holds an MSc in International Health Policies and Health Economics. She also has a master's in Public Policies. Currently, Lucy is the coordinator of the Evidence Informed Health Policies Unit at the Ministry of Health in Chile. This unit hosts the EVIPNet, the WHO EVIPNet Chile office. Prior to this, Lucy was the head of the Health Economics Department, also at the Ministry of Health, and she has worked in academia, international organizations, and other public sector agencies. Lucy, please, the floor is yours. You may proceed.
Thank you so much, Andrea. So hello, everyone. I'm going to share my screen. Just give me a second. I believe that one. Okay, so please tell me if you can see it properly.
Yes.
Yes? Okay, great. Thank you so much. So, well, yeah, thank you for this opportunity of sharing our experiences in Latin America and have the opportunity to learn better from the Africa Evidence Network. Of course, you're going to find some similarities between the challenges or the opportunities across Colombia, Brazil, and Chile, and that's one of the main reasons why we think it's so important to build a strong regional hub and to connect and to strengthen the links and the connections among us. So, well, as Andrea was saying, I represent the Ministry of Health. And before I tell you a bit more of the Evidence-Informed Health Policies Unit, I would like to tell you a little bit about Chile, like very, very fast, but just for those who doesn't know all our beautiful things. And so yes, Chile is located in the southwestern South America. It's a long and narrow piece of land of almost 4,300 kilometers long. We are about 20 million population estimated by 2020. While their GDP per capita is measured around $25,000, measured in purchasing power parity international dollars. We're a country of a very high inequality of income, and the estimation of the World Bank set a Gini index of measure of the inequality of 0.47. But that's tricky because that's a measure with household survey data where the high incomes are underestimated. So when you adjust the estimates using administrative data, then the Gini index increases up to 0.68. So other very, very relevant aspects of our country is that we have 2 Nobel laureates in literature, 2 Academy Awards winners, 20 medals in the Olympics and Paralympic Games, 2 times champion at the Copa America. And there was a very recognized Chilean scientist who were part of the group of researchers that discovered the recombinant hepatitis B vaccine and the virus that caused the hepatitis C. So, well, there are a lot of other things that I could tell you about Chile. So you're so much invited to come and visit if you don't. And now I would like to tell you, oh, sorry, all right, something's happening. No, there. Yes, so I believe that one of the most interesting aspects of evidence-informed policymaking in Chile is that we had a process, and we are still in a process of institutionalization of evidence-informed policymaking in the Ministry of Health. And let me tell you a bit of the history. Around a decade ago, the EBIPNet belonging to the WHO, the EBIPNet Americas, was created in 2007. And around 2010, it was promoting the evidence-informed health policy making, and some universities in Chile start to build capacities in the field. 4 years later, there was like this huge window of opportunity to create like an EBIPNet Chile office hosted at the cabinet of the Minister of Health. And at that moment, there was one full-time position developing rapid evidence synthesis, stakeholder dialogue, and developing methodologies. A lot of other processes happen in between, and in 2017, there was a very important milestone because it was created the Health Technology Assessment and Evidence-Based Healthcare Department, which articulated 3 units that were that already existed, and they were put together in a single structure to join efforts. So this EBIPNet Chile office was like renamed as the Evidence-Informed Health Policies Unit. And also there is the Clinical Evidence Unit and the Economic Evaluation Unit. these three units have very different objectives and specific objectives, but we share several collaborations on the development of evidence to support health decisions. Well, at that point in the evidence-informed health policy unit, they were developing some methodological guidelines, and from that moment until now, the unit began to strengthen the team, opening new full-time positions, standardized methodologies, following and adapting the GREAT framework. Of course, the production of rapid synthesis was increasing. We had diversified our products, create more timely methods of evidence for policies, improving the communication of key messages. And we have also tried to increase the awareness and usefulness of evidence-informed policymaking among the authorities and the professionals of the Ministry of Health. And while all this was happening, meanwhile, at the whole of HTA CPG, there were also other processes of health technology assessment and of clinical practice guideline happening. So, for example, in the case of the HTA, there was an HTA national committee created by the end of 2012, and it worked between 2013 and 2015 to propose the institutionalization of HTA in Chile. And several years later, it was created an HTA department, and that department was converted in the economic evidence unit in the department. So, and they work mainly in HTA processes of high cost treatments, cost effectiveness analysis, budget impact analysis as well. And also since 2014, the clinical practice guidelines were following the GREAT system and the evidence to decision framework to formulate recommendations. So so far, they have elaborated around 80 clinical practice guidelines and around 420 evidence to decision clinical recommendations, besides several syntheses of effectiveness of clinical interventions. And so, wait a minute, please. There. So yeah, so what do we do? What do the evidence informed health policies unit, which I belong, what are our products? And we can identify mainly in three areas, like evidence for policies, evidence synthesis of evidence, deliberative processes informed by evidence, and methodological development. And the evidence for policies, well, our main product is the rapid synthesis of evidence, and we have strengthened the methodologies, and we have adapted the techniques to the public health interventions, right? Because we have that perspective of health system interventions and public health interventions rather than clinical interventions. But we have also developed even more rapid evidence reports, like for the high authorities demands, which we could deliver in between 1 or 5 days. We have also developed policy briefs or evidence brief for policies. And even though the complexity and sorrow of the COVID-19 pandemic, it's also been an opportunity for evidence and for science. So we had the chance to develop an evidence gap map at the beginning of the pandemic, and exploratory synthesis following like a scoping review technique. We had some information on stakeholder dialogue, and we don't have much experience on citizen panel, which is like a huge challenge that we have for the future. But we do have a very interesting experience by using the evidence to decision grade framework to make a recommendation for a public health policy. And well, in methodological development, we develop workshops, national and international seminars, and we're also trying to develop innovation and new methods. So, so how do we do it? Well, we are a team of 4 mainly. So here you can see Carolina, well, me, Paula, Rocio, and Deborah. And Paula is on maternity leave, so we are glad to have Rocio with us on the team. And of course, we have a lot of help from and support from other allies like the EBIMNet and from the World Health Organization. As Daniel was saying, we also belong to the PEERS project, which is funded by the IDRC and the Hewlett Foundation, and is coordinated by R4D. We also have a lot of methodological development, and we've worked very close to the Cochrane collaboration, but specifically with the Cochrane Effective Practice and Organization of Care, the EPOC satellite group in Chile that is hosted in the Catholic University. And we also work with other entities, or we have been related with other entities in Chile as the Library of the National Congress. And of course, we have the support of the librarian and our colleagues in our department. And okay, 2 more slides. So, I don't know why, there. So what are we proud of? Like a lot, honestly. Since we are a very small team, we have been able to achieve a lot of success. So we are very proud to institutionalize evidence-informed decision-making in the Ministry of Health, which is definitely an evolving process that we need to keep strengthening and emphasizing the value of evidence. We have developed more than 100 evidence syntheses in 2014. During the pandemic, we could be of support for decisions, delivering on-demand rapid evidence synthesis. We developed a COVID-19 living evidence map during the first month of the pandemic. I told you about this evidence-informed health policy recommendation, which was like the first experience of not only delivering a synthesis of evidence, but also accompanying the process of decision of a panel of experts. We were working in tackling children obesity interventions. We were measuring and analyzing the determinants of obesity, and conducting 14 rapid syntheses of evidence about 2 years ago. We host the EBIMNet Americas regional meeting in 2019, just before the social outbreak came up in our country. And we are I'm very proud of my team. We're very committed, creative. We have a lot of flexibility and disposition to face new challenges, and all these changes in the ministry, because the head of departments and divisions change constantly. Every 4 years, there's a new administration, and sometimes you have to start all over again, like enchanting the new administrations. And there's always a continuous learning and improvement. And so what do we want to do next? And what are our future and present challenges? We definitely want to build a national evidence ecosystem, not only in health, but in other social policies. And we're interested in that's difficult from a Ministry of Health position, but we want to be helpful for the intersectorial policies. We believe that we can help with the interactions among different sectors. We are eager to build a strong Latin regional hub, of course, and with the help and support from the Evident Americas and other networks that we belong as well. We have a huge challenge of conducting citizen dialogues to really engage people in decision processes and account for their preferences and values. We are always trying to improve knowledge translation and how to communicate better. We want to facilitate decision-making process when evidence is scarce and uncertain, which is something that it's so evident, right? We see it in our authorities and in decision makers that they need like a clear answer, right? Does it work or it doesn't? What do you recommend? And that's not always a possibility. And well, of course, besides improving techniques and create useful tools, we are very into encouraging the awareness on the relevance of trust, transparency, and accountability of decision making. We believe that, yes, it's fundamental to base policy making on evidence, to know what works, what doesn't, how to make decisions under uncertainty, but it's also a great opportunity to base decisions and policy decisions on transparency. And when you're more clear and transparent on the information you provide, then the public trust in institutions increases. So I would definitely want to learn more about the Africa Evidence Network experiences. So thank you so much for listening. And yeah, please, if you have any questions, I'm happy to respond.
Thank you so very much, Lucy, for sharing with us how the evidence-informed policy approach can be institutionalized within a ministry, within a government department. Again, what has struck me from Lucy's presentation is, in addition to efforts and emphasis on production of syntheses, etc., there's also a focus on capacity building as well in terms of seminars, workshops, and developing different methodologies and tools. Let us move on now to Laura Boera. Laura is the Executive Director of the Instituto Baridas, which is a Brazilian civil society organization dedicated to knowledge translation. Prior to working at Veredas, Laura was a psychologist in the National Health System and a public servant in the Brazilian Ministry of Health. She has an MSc in bioethics and is currently pursuing her PhD in social psychology. Laura.
Thank you, Andrea, so much for being with us today. And I'm very, very glad just to be part of this wonderful event. I'm always amazed at everything that Africa Evidence Network is doing. And this program, this event is completely mind-blowing. So I'm privileged and grateful to be part of this. I'll quickly share my screen here to tell you about this Brazilian experience we have with doing evidence use from a civil society point of view. So actually, while we were doing this presentation, I usually translate the name of our civil society organization. It is called in Portuguese Instituto Veredas, and it translates to Veredas Institute. And then I discovered there is actually a Veredas Institute in English. So from now on, I'll only speak of us in Portuguese. But Veredas is a word that in Portuguese means shortcuts, and also means a bank of water that comes out of nowhere in a very dry land. And we were very inspired by this meaning. In Spanish, it also translates to something as a street. So it's very it's very inspiring to us the way we got to this name, this idea of connecting people and connecting places that are distant and bringing flow to places that might be some kind of stuck. So we created Veredas actually in November 2016. We'll be celebrating our 5-year anniversary now in November. And the idea of this civil society organization that is probably best known as a NGO, a non-government organization, was inspired by the directors, myself and my colleagues' previous experiences as policymakers. We all worked in the federal government, in the Ministry of Health, some of us in the Ministry of Justice. One of us worked in the Human Rights Secretary that used to exist in Brazil. And while we had this great opportunity to work from inside the governments and be where the decision is actually made, we were very uncomfortable with the way the decisions were being made. And in Brazil, I don't know about other countries, but it was very much important decisions being made in a very small room with very few people able to give their opinions. Whole policies being written by a group of 1 or 2 people, actually. So this was very unsettling for us, and especially we were very, very young when we were part of this federal government. So we still had all this adventure sense that things should be different, right? And then we were very lucky as individuals to get to know Jorge Barreto, who is one of the main champions for evidence use in Brazil. He's working currently at Fiocruz Brasilia, which is a school of government. And Jorge actually trained us as we were policymakers to use evidence to inform decisions. And then when we got all this training and were very inspired by this conversation, we actually decided that we had already great tools to do that, but it seemed very impossible at the time to do that from the government level. So we decided to create this NGO and do it from a civil society perspective. Also, when we were policymakers, we felt so alone often, and most of the civil society or other groups that were coming to the government for exchanges were rightly so just asking us why we weren't doing enough, but often weren't able to provide us with some help. And then we wanted to be this kind of civil society organization that could provide help for governments, and especially for public servants who were mostly alone and mostly feeling as the full potential of their positions weren't being fulfilled. And then because of our experiences, but also because in Brazil, the health sector was probably the one more in line with this perspective of evidence use. When we were created, we made sure to have some key focus areas that were not only related to health. So in Brazil, I don't know if this happens in other countries, human rights is often not understood as all the rights of humans, but just the rights of some specific populations. And we wanted very much to focus on these specific populations. We wanted to focus in the large indigenous communities we have in Brazil. We wanted to focus with people who are experiencing greater vulnerabilities. And we decided to make human rights one of the areas we would focus on bringing evidence to the table. We also had experience and really wanted to debate the criminal justice system in Brazil with this lens of evidence use, and labor market inclusion, which is actually in Brazil, one of the main challenges, and everyone seemed to put their mind in these challenges, but not many evidence tools were being used to help overcome these challenges. So from 2016 on, we were developing these areas. Now we have some other areas. We also have a very interesting work in public governance innovation, which has opened some doors for us to bring the evidence debate to the innovation groups here in the government. But mostly all of this was possible because we had, from the beginning, from the get-go, partners in the executive and the judiciary branches who really opened their doors for us to work together. And this, right now, we are very focused both in the federal level in Brazil and the state levels. We actually haven't been able to go to the city level so far, but we're very eager to do so, because in Brazil, cities and city governments have great power in decision making, and it's really where the action happens. But the federal and the state level have already demanded so much from us, we weren't able to get to the city level. But these partnerships with the government branches weren't enough. And expanding our partnerships with civil society organizations and universities. And when I use the term partnerships, I really mean radically working together from the problem understanding, problem definition, to the design and implementation of evidence-informed interventions. So this whole cycle is something that we really only want to take up if it's with collaboration, radical collaboration with these organizations. And luckily, we've been able to build very strong relationships, and I'll talk a bit more about this over the years. So our work as a civil society organization was only able to really fulfill its ideas and its mission because we have these great partners working together from the get-go. And we are very proud also of being able to build over these years 50 plus evidence briefs, rapid reviews, and gap maps that are published. And they are usually part of bigger projects that are not only focused on this KT products, but also in really understanding what's going on there in the policy arena and trying to propose stakeholder engagement, trying to propose ways where we can make these interventions identified more equitable. So this is very much part of our work here. Let me go. But of course, we have some challenges, and the main one is posed in this question: have you heard about the Brazilian political climate lately? These past years have been really, really difficult, and right now we're actually on the verge of a rupture among powers. So our executive and judiciary branches are really fighting each other, and we know from history this is not a very good sign about what's to come. And it really makes this collaboration perspective harder, because we have different politicians and strong decision makers really just, I'll be honest with you, talking trash about each other. So it's very, very hard to understand that we have to join forces and work together. And evidence use, as it is in many other countries, in one hand was very attacked by some leaders in our country. And on the other hand, people who are kind of skeptic about evidence use and had some criticisms about evidence are now really joining forces, because we have two groups, oversimplifying in Brazil, the ones who are pro-evidence and the ones who are against evidence, and people who don't want to be identified with the against evidence now started defending. So the pandemic was a very interesting moment in time for us, just having people who are skeptic and a little unsure about getting in the evidence train, jumping in and trying to drive it, because they were so really interested in not being portrayed as someone who is against evidence. But the political climate doesn't make things easier, and it has really we have a understanding in Brazil that when civil society work blossoms, usually it means that the government has shrunk. So this is something we are experiencing right now. Our work has grown so much in these past years, and we feel the government initiatives and the government power to propose even policies has shrunk. The interest sometimes even in proposing this. And this is very hard to balance, because while in a very egoistic manner, it's nice for us to have our work blossoming, we can clearly see public policies being undermined. And one thing that is always a reality, and right now is more of a challenge, I would say, is that even when we get some evidence champions at government level, it's really hard in the Brazilian bureaucracy for them to fund internal or external knowledge translation work. So it hasn't been hard for us to get funding for our work, because I'll tell you about this in the next slide, but we always aim for external funders, and we have to keep the government relationships very horizontal. But when we have some very interested policymakers wanting to develop their evidence unit or wanting to fund some knowledge translation work, it's usually very hard in Brazil to do that. It's hard to have a partnership between universities and governments. It's hard to have funding for a specific evidence unit. In the Ministry of Health, we have the executive secretary for EVIPNet, who is the evidence-informed policy-making network. But it has suffered very much with this idea of having funding and securing momentum for their activities, because the bureaucracy is just so big. And as Daniel mentioned in his presentation also, we have come to figure out that most of evidence is in other languages. We work in a knowledge translation perspective, but we also have the challenge of actual translation. And actual translation for knowledge translation, we've come to learn that it doesn't demand only a translator, a trained translator, but also someone who is trained in KT. So we've been working a lot in translating some great pieces, both from scientific evidence or international groups who work with knowledge translation, but only commissioning a translation service is not enough for us. We really need someone who is trained in knowledge translation to do the actual Portuguese to whatever language and whatever language to Portuguese translation. And the last challenge we've been experiencing is this huge increase in demand and a very, very limited supply. And when I mean supply, I mean human resources to do knowledge translation and knowledge brokering, and even sometimes this perspective of using evidence to policy. People who have these different abilities, they are mainly all connected. They are all overloaded with work right now in Brazil, and the demand keeps growing and growing. Requests for knowledge translation services at its peak probably right now since we created our civil society organization. But there is only so much you can do about capacity building. And in Veredas specifically, we have grown our team very much in this past years, but it's not only growing towards researchers. We have come also to learn that we need journalists, we need graphic designers, we need people with specific sets for different points of this policy cycle to come and join forces to make our products and our work relevant and usable. So really training people across these disciplines is something really hard to do. And of course, everyone also needs to have some notion on research. So it's quite overwhelming that we put many efforts in capacity building. We think, oh, now we have enough people to do that. And in the next year, we still retain everyone we trained in the past year, and we need like double the size of people to keep addressing the demand that is coming our way. And I'm saying this, of course, from a civil society perspective, but I know this is very much true from other groups that are in universities and that are in government level. So really having human resources trained to address all this demand is something hard for us. And then luckily, we also have some facilitators. So the main facilitator for us was and is always conducting and updating our stakeholder mapping and evidence ecosystem assessment. We are always very pleased to discover more people joining this train. We are also very aware of these windows of opportunity that sometimes come when we have a change. Like the instability in the political system is usually not a good thing, but once it changes some chairs and now we have in a very important position someone who is really open to evidence use, as a civil society group, we are able to shift focus very easily and just focus on these great windows of opportunities. And we're very lucky to have people who are more and more sensible and engaged in this perspective, wanting to work together, wanting to learn with us and from us. So doing this continuous stakeholder mapping and evidence ecosystem assessment help us shift focus and really put our chips in windows of opportunity that might be more able to flourish. Also, as we mentioned, this participation in networks has expanded our universe so many times. I'm very grateful. From the beginning, we are part as an evidence center of EVIPNet Brazil. And then we joined peers soon after, and it has been such a great opportunity to exchange and learn from other countries and really get these great ideas and test them in Brazil. We are also part of Evidence Synthesis International, and we are member of the 3IE group. as I mentioned, we really have developed and refined and now created our own method of capacity building efforts. We have developed alongside Georgie this great course with mentorship that we have been giving in government settings. We have trained over 100 government employees so far. We have trained some researchers from different organizations also. And right now, this week, actually, we are starting a course that is part of a great initiative in Brazil, and will be shared with other organizations. So this whole idea of really not only giving courses, but mentoring this work until people feel secure enough to take these KT tools and make it their own is something very nice that we have been able to develop over the years. And from a civil society organization point, of course, in many times you can have some insecurities. You are not as legitimate. You have not guaranteed funding most of the time. But I really think personally that it overcompensates when you have this much autonomy as we have to shift focus, to try new strategies. We have very much space to mistake to have mistakes being done all the time and learn from them. We are not usually people are not expecting us to overperform. They are just expecting us to learn lessons and try to disseminate them. So this autonomy is something I wouldn't change for the world, and it's a very interesting and specific, I feel sometimes, aspect of being a civil society organization. And we also have this capacity to collaborate that really transcends the political agenda of our organization, because we are the ones who set this agenda and we review it every year. So when we are part of the government, sometimes we weren't able to publish things, sometimes we weren't able to sit in meetings with some kind of stakeholders because there was a whole political background that didn't make it possible. But as a civil society organization, in the nicest way, we are very promiscuous. So it's very hard to keep relationships going with different stakeholders and not have so much of a political chip on our shoulder. And then the way we establish most of our work now is just we offer ourselves to governments, which is very nice, and submit the idea that we create together to external fundings. And usually this external funding is international or from other civil society organizations. And what this has built for us is just trust through very long-term partnerships. We have partners that we work since the beginning of our organizations that are really coming to us every year, wanting to do something new together, drawing from the lessons we learned on the previous project, and this has been really fulfilling. And now, what we are looking forward to, one of these things that comes with a long-term partnership is that our partners are really pushing us to develop tools for this whole evidence to policy cycle, and not only the problem definition part or the seeking for solutions part, but also the implementation, the monitoring, the evaluation, the learning, the designing this policy intervention. So we've been really provoked on developing more tools and learning from other countries how they're doing this. In Brazil, for sure, equity and implementation are big question marks. Is this evidence good enough for our context? Will we be able to not make this intervention something that causes more inequality? We have it enough as it is. And how can we implement in a country that is huge, that it has so much inequality already, that is all regions have autonomy, or cities have autonomy, so how we can make a national policy or something that really is nicely distributed to through our territory. as I mentioned, these graphic design and communication efforts are really, really important to us. So how can we test these new tools and efforts and learn from other people who are doing great graphic design and communication work on evidence use? And then probably what we are most excited about is we started last year being part of this great initiative that is the Brazilian Coalition for Evidence. We were able to map through a simple Google form many organizations that we didn't even know were working with evidence use to policy making. And now the coalition has almost a semester of active work, is starting this great course shared by multiple organizations to train members of the coalition on how to really use these great tools of knowledge translation to make evidence more available to different policy or decision-making contexts. And we have great plans just to being together, thinking about how to push this evidence use agenda in Brazil. We have people from universities, from civil society organizations, from government levels, from the legislative branch, the judiciary branch. So it's very interesting. And of course, the Latin American Evidence Hub, which is a very Africa Evidence Network inspired initiative that we are trying to start and build from scratch, learning, of course, from what EVIPNet Americas has already done, other networks have already done, but trying to really connect the dots. In Latin America, we share so many of the same problems. We share so much of this instability. It's like a contagious disease here. Once one government has a little hard political time, the other governments in the region almost start to have the same. So this is something that we are very keen of doing and learning together. And this is probably the thing we are most looking forward to. So thank you so much for joining us today. This is our contact information, and now let's go to debate.
Laura, thank you so very much. We actually are running out of time, but we do have, I would really want us to squeeze in quickly. We do have a question, two questions actually. Lawrence has asked, he says, thanks for the fascinating presentations. I wonder if you can elaborate a bit about the current thinking of the structure of the Latin American Evidence Network that you're thinking about. Will it be a virtual network? What types of engagements are you planning? What type of benefits do you think you might be derived from it for your day-to-day work? So that's a question. Let me put it either Lucy, Laura, or Danielle, you're free to respond.
I think Laura is the better person to answer this question.
Laura, share with us your thinking, please, on this structure.
Well, thank you, Lawrence, for this question. And I think this is very something we are thinking as it goes, right? We were so inspired by your Africa Evidence Network event last year, and just learning from the history you were able to do. And it seemed to us that it was very much about connecting people that are usually disconnected. So understanding who is doing this work in our countries and creating a virtual space for sure for them to connect. We actually are thinking a little bit ahead of this and trying to build a team for this engagement and capacity building, and probably identifying shared problems for us to really join efforts, because I seen also Ruth asking about how we connected. We connected through this international partnership, and we share so many interesting facts as countries together. We are always talking and asking for Lucy or Daniel to send materials my way, things they're done that maybe answer problems we have here, translating stuff. But this was only possible because we are connected through this international network that is peers, and otherwise we probably wouldn't even talk. And even being connected is so hard to do things together. So we are trying to think of ways to first identify who is doing this work in our country, second, connect them, and have a team, a Latin American team that is really focused on always making sure this network is active, that people are talking, that people are not doing the same exact work just because they don't know what's going on in other countries. Hopefully one day we can even join forces and have cross-country KT efforts being developed. We know every organization has so much in their plate already, but we have this bet that together we can do more and in less time, and more connecting these countries and being relevant cross-country work. I'm not sure if this answers everything, but it's the first thoughts.
Thanks.
Yes.
Thank you so much. Let me ask, I know we're really out of time. It's 11:31. I don't know if there's anyone online who wants to quickly interject, because I wanted to get a sense of how do we think, if we think we can have collaboration, South-South collaboration, Latin America and Africa. If we can take if there's anyone there, 2 minutes to share their thoughts on that, that would be really, really exciting. So feel free in the last 2 minutes, quickly just unmute yourself if there's anyone. I guess there's no one with any ideas for us. Well, let me say.
Ruth has opened her camera here.
Okay.
Do you know, all I was going to do was say thank you, because I've known the three of you for a while and heard you talk about your work, but I've never heard such lovely presentations all together. And I've never heard the history of how your centers came about. And I feel like I've learned a lot and I'm feeling very inspired. So thank you very much.
Excellent.
Thank you.
You're welcome.
All right. Well, if there's no one else, let me say a heartfelt thank you to Danielle, to Laura, and to Lucy for their presentations. As we indicated, it would be recorded and made available to the participants. And let me thank the participants for sitting in and hearing what has been going on in Latin America. I look forward to hearing more about future collaboration, not just the Latin American network, but also collaboration across the Atlantic, deeper collaboration with Africa. So colleagues, once again, thank you so very much for joining us today, and do take care. Over and out. Bye-bye.
Bye. Thank you so much.
Thank you.